Hello dear friends, good evening. We are back with yet another episode of BMC Global Live AlHilal Health World, nothing but lifestyle. I am Jasila Mujib. High blood pressure and high levels of cholesterol in blood is always a matter of concern. We are delighted to have with us Dr. Khalid Khalil Afifi from AlHilal Hospital, Sitra with us to discuss this issue. Doctor had been here before to discuss many relevant topics, and I welcome Doctor to today's episode. So Doctor, welcome to the show.
Thank you for having me again. I think for the fourth time now.
Yes.
Yes.
It's always a pleasure to have you here with us.
Pleasure to be here with you.
So Doctor, can you define what is hypertension, what is hyperlipidemia?
Before we go into the definition, I would like to just state one thing about the impact of these conditions. They are on a scary rise nowadays in society, globally, regionally, and locally. They are some of the fastest rising causes of morbidity and health issues that we're having. And they like to play together. They're like the bad friends that you always got warned about. So hypertension is an abnormally high blood pressure. And hyperlipidemia or dyslipidemia is an abnormally high cholesterol level. There's multiple types of cholesterol in the body, and having an imbalance in those gets called dyslipidemia, hyperlipidemia, and hypertension. Now, by definition, anything above 140/90 is starting to get considered as high BP, high blood pressure. But these numbers, to many people, to get into the aspect so that they can visualize it and understand it, is quite simple. The heart is like a pump. 2 chambers at the top, divided, 2 chambers at the bottom. And they work in sync. So when the pumping is happening, that's the number on top. It's always higher. That's the top number. And the bottom number is when the heart is actually relaxed, being filled by the blood coming back from the body, and that's the relaxation. So upper number, lower number. That's high blood pressure. And we grade it differently. So anything between 120 over 60 or 70 up to 139 to 89 is considered normal. Above that, we stage it grade 1, 2, 3, every increment of 20 on top or 10 on bottom. And hyperlipidemia, there's number normal ranges, and anything above that is considered abnormal or high. And also there's the ratios of them. The ratios are also now being more researched, and their impact is being discussed more as we come to understand it, because this is a developing field. Much research is being put into this because of the impact that we mentioned earlier. That is one of the leading causes of morbidity and mortality around the world.
So how can we say that? What is a metabolic?
So if we look at these two, we can classify them as metabolic diseases. They both fall under the umbrella of metabolic diseases.
So doctor, what exactly is metabolic disease?
So a metabolic disease is any impairment in the body's function and utilization of the nutrition and energy systems that we have. So macronutrients, as we discussed before in the previous topic, health outside of the prescription regarding lifestyle and nutrition, macronutrients, protein, fats, carbohydrates, vitamins, minerals, all these things, the lack or improper utilization of them in our body is called a metabolic disease.
Now coming to the syndrome, how can we define a syndrome, and what is a metabolic syndrome?
So a metabolic syndrome itself is, by definition, metabolic syndrome is an entity. By definition, a syndrome is any collection of problems or symptoms that a person is having. So metabolic syndrome is a collection of these metabolic diseases that might be happening, and it entails having high blood pressure, having high blood sugar, high triglycerides, which is a type of the cholesterol or LDL, and low HDL, which is another type of cholesterol. Now, if you look at it, we have high type of cholesterol and another one that is low on it. So the good is low, the bad is high. And of course, one of the things that is also entailed into it is a large abdominal waist circumference, so abdominal big belly. So all these together become called metabolic syndrome, because there's multiple things happening at the same time, making it a syndrome.
Yes. Now, can you explain the causes of this? Exactly what are the causes?
So when we look at the cause, as we discussed yet again in the previous session, is that it's multifactorial. There's many things that can end up leading to this. And it doesn't happen overnight. It doesn't happen immediately. It's something that can happen over time. Now, when we said multifactorial before, we look at it again now and revise it. It's having either a genetic predisposition or a genetic certainty, depends on the level of genetic predisposition, and environment. Now, we have many people who we end up asking about family history. Does the mother, father, relatives have this issue? Does it run in the family? And then we ask about the lifestyle. A combination of both puts someone at risk, and it develops over time. Now, for blood pressure, hypertension, elevated blood pressure, it's something that happens over time where the body starts losing control to regulate that blood pressure just because of the factors leading to continuously elevated instances of high blood pressure, make the heart and the regulatory system, which is actually a relation between the heart and the kidneys, to regulate blood pressure. These factors can, other than genetic, include either a person is eating healthy or not, so type of nutrition, fats in the nutrition, how much sugar someone is having, something called oxidative stress, which could be related to smoking, emotional and mental stress, and very importantly, lack or presence of physical activity. So how much you have of the good, how much you have of the bad, it ends up being in an equation of please do more of this and less of that. That balance is the main leading factor towards if someone develops this or not. Now, we can always think of an instance of someone being very angry, very stressed. The blood pressure will shoot up. It doesn't mean that they have hypertension. It's in that instant that their blood pressure rose. Even then, it may cause immediate risk for them. But over time, being built up is differently also, the loss of control. Hyperlipidemia is a similar also instance. It takes time where the body loses the ability to utilize those energy systems through the nutrition properly. And it's just a build-up until one day, over many days, you diagnose it and you're like, oh, this has been going on.
So can you now explain about the symptoms of hypertension and also other symptoms for hyperlipidemia?
Yeah, so they're quite vague actually. That's the thing about them. They're not clear cut. They are systemic and overall symptoms that when they're present, we have to think about these things as part of other possible differential diagnoses. Now, when we're looking at this, we will have that someone with high blood pressure might often complain of recurrent headaches, that they feel a chest tightness. Sometimes that's even a chest pain. It's not continuous, but it can come and go. They can get bouts or spells of blurred vision. They can get a bit of a shortness of breath. They can come describing a malaise and lethargy, tiredness, general sensation of not feeling well, their well-being. They just say, I don't feel right. They might have difficulty going to sleep, waking up without not feeling rested. Both of these things are vague symptoms, right? Could be what? Could be vitamin D deficiency, could be I haven't eaten properly, could be I'm dehydrated, could be my mood is off, I have so much stress, right? So general symptoms. Now here's the tricky part. Sometimes zero. Zero. Personally, I've personally seen, and many physicians will tell you that they've seen people who are coming in with grade 3 hypertension, meaning it's going off to 180 by 100 being normal up to 140, 90 maximum, right? 180, 100, 110 in the diastolic, No, are you doing fine, sir? Well, I'm completely fine. Do you have any headache? No, I'm good. Any chest tightness? I feel like a horse. Completely fine. Now that's where they become sneaky, these conditions. They can be present, doing their damage on an internal level and a physiological level without the person even knowing. And that's why it's important to check regularly without waiting for symptoms. That's why we also have screening programs. For everyone above the age of 30 or 35, we just check.
Now, can we say that these two conditions are lifelong? What is your suggestion?
Unfortunately, yes. Unfortunately, yes. But control has to also match that longevity of the condition. So lifelong doesn't mean that there will not be control for all the life. The whole point of understanding that they are chronic is it means that our management of them has to be continuous. We don't control it. Oh, the blood pressure is good, I'll stop the medication, or I'll revert back to the lifestyle that I had before that led me to this point, which is a very, very, very common mistake that I find. I had high cholesterol, or I had high blood pressure, I took the medicine, and it became controlled, so I stopped it after 3 months, thinking that they are cured. That is a little bit of a mix of denial and misinformation or misunderstanding about the condition. So explaining things to the patient and to the people who come to us to the clinic is the greatest asset in actually empowering them through understanding. An empowered patient is the leading factor in proper management.
Doctor, now we would like to know about the complications of these two conditions.
So imagine this. Imagine if you imagine that the heart is a pump. Of course, it's an adaptive one. It can go up and down. As we said, if someone is really stressed, it can go up. And then the kidneys respond, and they do some certain changes to bring down the blood pressure. It might be through release of excess water. So it reduces the volume of the fluid in that pump to reduce the pressure. It might, for example, dilate the blood vessels in the extremities, in the legs, so that it can accommodate more of that fluid, thus less pressure on the pump. That's the immediate effects. Now, if this is lost and all the blood pressure at a heightened level is going to what's called end organs, mainly the ones that we think of or that we really get affected, most sensitive to, are the kidneys themselves. A high pressure flowing through them damages them. To the eyes, small area, minor blood vessels going in, high blood pressure could cause a lot of eye damage. The brain, which is supposed to have a very regulated blood pressure flowing through it, if that is lost, then the brain can start getting affected, and mainly through vascular disease, vascular conditions, either a stroke, be it a hemorrhage or an infarct, a block. Then the heart itself starts becoming affected. Like any other muscle, if you work it, it will grow in size. So sometimes the heart becomes larger, and the risks that, paired with high cholesterol, can cause narrowing of the blood vessels, which is some of the leading things that we now see in society. Heart attacks, strokes. Before, it used to be associated with elderly people, like older people. Now we're finding them in people who are in their 30s, 40s. It really puts a big question of why, what's going on, what is causing this? There must be a reason. And then if we go and we look at what has changed in humanity and how they're living now versus 30, 40 years ago, then you find the answers. How we're eating, how we're not moving. I'm not going to say exercise and go to the gym and become a bodybuilder and a full-on athlete, but at least the level of movement in a day. It's called sedentary. Sedentary means just sitting, not moving. So reversing these things one by one has an accumulative effect. So 1 + 1 = 3, not 2. because each one builds on the next. So that's actually the good part. That's the message of hope, that small changes happening at the same time make a bigger effect.
Doctor, can you explain about the treatment options and also the lifestyle modifications to manage these conditions?
So as we discussed before, holistic approaches throughout every aspect. There's something to be done in every step of the way. So the mainstay, if someone reaches to a level, to certain levels, it's medication. But what about before that level? So after that level, there's so many options of medications, customizable and tailored to each different patient's needs and circumstances. We look at age, gender, other medical issues. Do they need tighter control, or can we be a little bit lax? This person is capable and willing to do other changes. So if we're looking at nutrition, for example, there is the DASH diet, dietary approaches to stopping hypertension. It has a list of things, do's and don'ts. Eat less of this, eat more of that, stick to that. It includes lower salt intake, 2 to 4 grams in the whole day. That's about what, half a teaspoon? How much do we eat of salt every day? Then we have which type of fats to eat, because these two, they play together. High blood pressure plus high cholesterol are much worse than one or the other alone, and they tend to follow each other. They like to play together. They're like the bad friends, along with high blood sugar. If one is there, the other ones are nearby, if not there. So then we have that. We have the increased water intake. We have the increased activity and the proper sleep and mental health and emotional health that we have to promote in these people. Between all this, that's the holistic approach. Exercise regularly. It can be even as steady as walking, 30 minutes a day to start off. After dinner, you will sleep much better. It will let you relax at the end of the day, emotionally absorb the day, mentally absorb the day, process it. Any excess of food that you might have had into the night, it's burnt a little bit through. The body has used it up. You are actually promoting regulation of that blood pressure, because the heart is pumping and the blood vessels in the legs are opening up to accommodate that blood. So it reduces that blood pressure. Now, this takes about 1 to 3 months to take proper effect. For people who haven't reached a certain red line, we try 3 months of what we call LSM, lifestyle modification. It encompasses all this. One pattern that will target high blood pressure, high cholesterol, and high sugar, including weight control, reduction, that will happen spontaneously if someone does it correctly. It doesn't need to be 10 kilos a month, but we plan it over initially 3 months up to 2 years. So we're going a bit relaxed on this if we haven't crossed a certain line. But if someone comes to me with a blood pressure of 180, 100, my main goal here is to protect their heart, their kidneys, their eyes, and their brain. Everything else to follow. So we start the medication and we say we will revisit the topic after optimal control is there for 3 to 6 months. Not in 3 to 6 months, but optimal control for 3 to 6 months. Maybe we'll reduce some medication. Maybe the patient now is much more educated. They come and they say, I see the difference. I feel the difference. I'm sold. I'm a believer. Then we can try with watchful approaches to possibly reduce the dose, because we also don't want to drop the BP. Yeah. When it comes to high cholesterol, the mainstay is statin. It's a type of medication that reduces the cholesterol itself. Everything in a balance. Everything has its possible side effects, but we as physicians, we know them and we can calculate for them, but we cannot calculate for the complications that these conditions might cause. And that's where the difference is. And I would like to always tell the patients, at least I know what the side effects of what I'm giving you could be, and I can monitor them. But if I leave you with this BP, I cannot tell you what effect it may have soon or late.
So, Doctor, now you mentioned about the holistic approach. Can you make it more clear for us, the holistic care to manage these the diseases?
I have a little paper actually in the clinic. It's very simple. It's an A5 paper, and it has two columns. The one on the left is reduce, the one on the right is increase. So reduce all of this, increase all of this. Simple equation, right, to regain the balance, like a scale. On the left side, it says from the top, no more fried food. Second one is to reduce simple carbs, means white sugar, brown sugar, all types of sugars and sweets. Next to it, because I have a lot of patients from the Asian community, so I tell them less chapati. Because it's a lot of carbs and fats, but not much of the other macronutrients, protein, vitamins, minerals, all these things is lacking. Then we have reduction of salt intake. Now this is an important point. Not just reduction of salt, but the type of salt we use. So most people have table salt. This is the worst kind, just to be clear. Go for sea salt and go for Himalaya pink salt. The difference is that sea salt is refined salt and it's very high in sodium. So sodium itself is a driver of high blood pressure, whereas pink salt is a more natural substance, and it still has more minerals, not just sodium for the saltiness flavor. It has magnesium, it has potassium. So sea salt or Himalayan salt actually are more raw to nature, not refined, and have a less impact and more overall benefit for health than using. So if you're going to use 2 to 4 grams of salt, still let it be pink Himalaya or sea salt, not table salt. That's number one. And then we have that the last meal should be 3 hours before bed. Digestion takes about averagely 1 to 2 hours. For someone who's a slow digester, it can be up to 3. So if you're going to sleep heavy, your body still, say you ate and you slept directly, all those nutrients are still there, and you're definitely not going to be, unless you're a sleepwalker, you're not going to burn through these calories. So your body's going to be busy digesting and not resting and recuperating and recovering from the day, which is the point of sleep. It's a time for your body to recover. But if it's doing 2 things at once, it cannot. We would be kidding ourselves. Even humans, most people, unless sometimes women, they're great multitaskers. But in general, even your body cannot multitask. Then we go off to reduction of mental and emotional stress. So coping techniques is very important, how to break high tension, high anger situation. And finally, the reduction of alcohol and smoking intake if it's there. Now that's the left. That's what we're doing less of. What do we do more of? Natural raw, vegetables. Get them from the farmer's market. Here in Bahrain, we have plenty. We have farming land, plenty of farmers market. Once a week, go get a whole batch of all colors, all shapes. So go for the purple, orange, yellow, green, red, everything. Take them home, wash them, chop them up, spread them out on a tray into the oven. Or an air fryer if you use one for smaller batches. But with that big amount, you can prepare 4 to 5 days worth of food in one go. You don't have to worry about it. That should be half the plate of your lunch. That's the nutrition part. Then we go for complex carbs. Potatoes, brown pasta, brown bread, brown rice. It's better options than the whites. Then we go off that we have to eat fiber. Now this is a very important point. Fiber alone, 2 types, soluble, non-soluble. Soluble means it will be broken down. Non-soluble, it will go out as it came in. Very important for how the food flows through us. Prevents constipation, keeps us from feeling hungry very fast. And fiber alone, between 25 to 30 grams per day, has been proven through a lot of evidence-based research to reduce levels of cholesterol, cardiac disease, colon cancer, diabetes. So this thing alone, and coming from the natural sources such as mentioned above, alone it is such a protective factor and needed, especially for people who have these conditions now. Then finally, we have to do the exercises. Our goal is to reach 50 to 60 minutes of fast walking, like someone's late for a meeting, 5 times a week. But of course, they have to gradually build up to it so the body can adapt. So 30 minutes 3 times in the first week, 45 minutes 3 times in the second week, 45 minutes 4 times in the 3rd week, and slowly build up. Add either 1 more day or 15 minutes more, and it will do the trick. And then you have it finally in accumulation, choosing the right kind of fat and oil. Olive oil, pure virgin olive oil, clarified butter or ghee, and having less of all these new types of oils. So we're supposed to have less of margarine and these synthetic oils that we have. Stick to as natural and as clean, unrefined as possible is best.
Doctor, you have already mentioned about all the aspects of hypertension and also hyperlipidemia and also the lifestyle changes. But have you any advice for our viewers?
I would say check early. Don't wait until something's wrong. You don't have to be ill to go to a doctor. Part of what we do, especially as GPs and family physicians, is something called health promotion and maintenance. Many people are unaware of how over the decades their body changes, their physiology changes, so they can't keep living the same lifestyle. I often tell the patients the bill often comes at the age of 30. The first 30 years is kind of like a trial. First 10 years, definitely you get away with many things. You can fall, you can break, you can do everything. 2 weeks, you're absolutely fine again. But the recovery is different when you're 30 and 40. When I broke a bone when I was 10 years old, it took me 2 weeks. When I broke a bone when I was 29, it took me 4 months. Yeah, true story, I've broken a bunch. But the thing is, we have to also adapt to that. So people understanding and having awareness is the biggest promoter of health. So come in for health promotion and health continuity and maintenance. One of these things is early screening. So above the age of 30, go in for your first cholesterol, blood pressure, and fasting blood sugar checks. This will tell you, do you need to check every year or every 3 years? Or do you need to check in 2 weeks? Sometimes we are. I'm diagnosing people under the age of 20 with diabetes. 20 years and less, having high cholesterol. That means that at least for the past 5 years, things have been going under the table, under the radar, wrong. So this tells us what kind of shift we're having. That makes us as healthcare workers need to strengthen we need to go out there and we need to send the message. We need to grab the people to come. Because someone might not know what's good for them. We should definitely take the initiative to tell them, hey, come in for a chat. So I would tell them check early. There's always something and much to be done. And it doesn't always lead to medication. Of course, we're always hoping that we don't end up in that, but it's better off to deal with something in the beginning than to deal with the complications that might come from it. Deal with the hypertension better than dealing with the chronic kidney disease. Deal with the cholesterol better than dealing with the stroke or the MI.
True.
You see, this is the most important thing.
So thank you, doctor. Thank you very much.
It's a pleasure to be here again. Thank you for having me.
More relevant topics in future.
Hopefully, we can help you and help your viewers and your listeners, and many more people can reach this message that we are here for more than just dealing with the fact after the fact.
Yes, yes. So, viewers, I hope this was a very informative episode. So, as doctor said, prevention is always better than cure. So, go for medical screening on time and don't wait for the symptoms to appear and don't wait for the complications. So, till we meet again in yet another episode of BMC Global Live AlHilal Health World, this is Jasila Mujib signing off. Good night.